Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's overall health, the Myohacker podcast is your guide. Hi, I'm Karindy, a speech-language pathologist, myofunctional therapist, and a mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this important information. Visit myohackerslp.com for free resources and guides. Quick disclaimer: the content shared in this podcast is for information and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult a professional regarding your circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. Now, let's dive into today's episode.
Welcome to the Myohacker podcast. This episode is going to be a solo episode, and I was inspired to talk about this topic because it's very important that we utilize or that we use neurologically salient or impactful methods when we are retraining behavior, when we are trying to modify the way that the body is doing something. You know, there are different ways to do it. And because of my background working with neurological impairments, that can be from stroke, it can be developmental, things like that. I tend to approach things thinking of how can I make this really salient or really meaningful to the brain. So I have a patient who his mom was having issues with her foot, and I won't go into that whole story, but basically I showed her some techniques to help her connect the firing and the imagery and just that awareness of the brain to that toe that had been injured, had been kind of misfiring for a while. And, I was showing her these are techniques we use for your son when it comes to retraining placement of the tongue and swallowing, chewing, things like that. But the fact is you can apply these methods to any aspect of motor movement. Now, it gets a little bit more nuanced as we're working on strength and range of motion, things like that. So I'm not saying that I'm going to be treating someone's foot, but I want people to be aware of these approaches because this patient, she was so sweet. She was like, this has been more impactful. She was able to really connect movement back through her toe, get the elevation, get range of motion, increase the strength and just her ability to move it quickly pretty quickly once she used some of these techniques, which is why I want you guys to understand it. So, and from her mouth, she was like, it has been more impactful for you to tell me how to do some of these things than it has been working with different PTs who are supposed to be specialized in the feet. So I want you guys to know, we're going to talk about a few techniques. One is going to be vibration or tapping. So anytime we add, just think of it, it's going to be a sequence of pressure, and then you remove pressure, pressure, remove pressure. We consider it vibration because it's faster, but if you were just doing tapping on a certain area, that is still, the brain is going, hey, what was that? What just happened over there? So in the context of myofunctional therapy, let's say I'm helping someone with elevation of the tongue because their tongue is resting low behind their bottom teeth. Let's say that you're a mom at home and you see your kids, they're, breathing through their mouth, and it's because that tongue can be because of a lot of reasons, but maybe you see that the tongue is resting low behind those bottom teeth. What you can do is tap on the tip of the tongue, and then sometimes that's enough just to be like, okay, did you feel that? And you want really it to be that front, let's say the front edge of the tongue. It doesn't even need to be the tip because we want it to be more than just right at the tip of the tongue that it's resting up in the palate. But you could do a little bit of tapping there and then ask them, okay, where did I just touch? And then have them point to their tongue. Then you could say, okay, now can we bring it up, up, up? And that you can tell right now I'm talking as if I'm talking to a little kid. I could say the same thing with an adult. I'm tapping their tongue and then I'm like, all right, now I want you to take that. You might still feel a little bit of that pressure, a little bit of awareness. Sometimes people will say after the fact, they're like, I feel pulsing, even though they no longer actually have anything pulsing. They might feel that. And then we can retrain. Once we have awareness to that site that we're wanting to change, that we're wanting to shift, then we can add in the cues of, okay, now I want you to lift it up. It's going to be best to give a target. So like in the instance with this adult who I was talking to her about how she could use these neurologically salient, what that means is like, we just want to give some contrast, some different signals that help the brain pay attention to something that it's kind of started to ignore because it's figured out it's homeostasis. And in the case of this adult with the toe that wasn't moving the way that she wanted because of this injury, and then she'd kind of gotten disconnected from it, and now it was just hurting. We talked about different ways to give her a target. So, she wants to lift her toe, but if she doesn't have something she's lifting towards, then it's harder to aim for anything. It's the same, like we can be like, oh, I want to be healthier in 2026. Well, what does that mean? Okay, that can be a lot of things. Same thing with the toe, same thing with the tongue. You want to lift it. Okay, lift it where? Are you going to lift it all the way back so it's curling toward your tongue, so it's curling towards the back of your throat? Or in the case of the toe, are you going to lift the toe so that it's off the ground? And that can just be like a hair. It doesn't have a millimeter. It doesn't have to be very high. Or are you going to lift it all the way back so that you can totally dorsiflex through the toe and it's almost touching your foot? Or are you going to lift the tongue so it's all the way up and it's all the way back into your palate? Like, what is the goal? We want to be clear with that. So sometimes giving something to hit as the target can be helpful. So in myofunctional therapy, we will give placements. Like we like to use the incisive papilla, which is a little pad behind the two front top teeth on the palate. And we'll be like, okay, I want you to touch the incisive papilla with your tongue. That's one goal. Okay, you could lift it up. We want to then get the back of the tongue to elevate into the palate. Again, what does that even mean? So you might use tapping there, and then you could tap on the palate and go, okay, did you feel that tapping? I want you to get back up into the palate where it was. And there's more to say here. If you have a posterior tongue tie, if there is tension in the back and the floor of the mouth is really tight, lifting the back of the tongue isn't necessarily going to be just a force of will. Sometimes there are structural reasons why we're not able to lift and get it back there. Same thing with the toe. In the case of this patient's mom is that, she had an injury to the toe, so she wasn't able to move it. But in her case, then she was able to get some treatment that gave her that range of motion back. But she was like, I'm just not connected to it. It's not happening. And this is where it's important that we make these changes. Same thing with the back of the tongue. Okay, let's say you've done a posterior tongue tie release. Hopefully, you've worked with someone, a myofunctional therapist, on this prior to doing that release. But in that case, that's where it's like, okay, we're going to elevate the back of the tongue, give some pressure, give some tapping, and elevate into the tapping on the palate. Okay. We're going to talk about another way that you can give salient, or think of it like it's a quiet chamber and all of a sudden you're whispering. Your brain might like, oh, it hears that. It's a different signal. Okay, how do we bring awareness in this sort of quiet chamber where the brain is kind of, it's no longer paying attention to what the body is doing in this area, because it's like, we figured it out. We are in a good place now. Let's move on to other things that take more of our time and our energy. Okay. The brain really wants to get to a baseline and just stay there. It's more calorie efficient for the brain if it's not having to reorganize often. So by tapping, by giving some pulsing input, we're waking up the brain that no, the signal is changing over here. You can also use things like temperature. In the mouth, obviously, cold is going to be better. You can do warm, but just be careful. It's so easy to burn the mouth. So it's typically easier to do something that is kind of cold. I love to use like the side biter. It is a great chewing tool, and you can fill it with yogurt, freeze it, then it's kind of cold. And then, okay, you're going to have a little bit, use the side biter, tap on these targets. Let's say I'm wanting them to lift the sides of the tongue. I can use that cold on the sides, the back sides of the tongue, which that can be meaningful. Let's say if we're trying to say that the sound R, we need some tension back there. You can tap the sides of the back of the tongue. Again, you'll see I mix some of these things. You don't have to tap. You could just lightly present that cold temperature through like the frozen side biter or even a popsicle. Let's say you've got a popsicle and it's frozen, and then you're going to present a little bit of that on the side of the tongue. If you take that plastic cover off and it has some taste now you're adding in that taste, that saliency, but then take it away. If all of a sudden we have it there and they're like, okay, I'm just eating, it's not as therapeutic. So we want to bring, again, that awareness. And depending on how old the patient is or the kiddo is, you can only do that a few times before they chomp it. And they're like, no, I want that popsicle. I want that snack. So use that time as you can and make that signal salient, make that taste salient. What that means is that it stands out. It's contrasting with what the tongue is normally doing, what the body is normally doing. Okay, so you can do that. Those are just a couple of things that you can do to really help with organizing, or not even organizing, initiating the body's ability to start organizing a behavior that it has said, no, it's fine. We don't want to mess with this. We've got our orderly system in place. Please don't change it. The fact is, if we are wanting to modify something, we're going to change it. And so we want to make it where the brain wakes up, pays attention when we then demonstrate how to do that new behavior. Okay, I hope that was helpful. This was just a quickie episode, and we have a lot more coming in the new year. Very excited about some things coming your way. So stay tuned, and I hope to hear from you all soon. Also, if you are a provider and you are really looking in how to utilize brain-based techniques in your practice while also leaning into your intuition, I want you to reach out to me. I have my next cohort starting up soon, and hopefully by the time you listen to this, you will have an opportunity to reach out and schedule a discovery call to see if this is the right fit for you, for your practice, for where you're at as a practitioner, in wanting to provide the best evidence-based practices while also really training your own intuition so that you tune in to those micro signals that others are missing, and so that you're able to really bring together the pieces of the puzzle that need that intuitive detective to be on board.
I hope you have enjoyed this episode of the Myohacker podcast. Remember, small changes can make big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review wherever you get your podcasts. This way, more families will learn about this important information and we can make a bigger impact. Head on over to myohackerslp.com for in-depth resources and guides. You can also join me on Instagram at myohackerslp for bonus content and demos. And if you have questions or topic suggestions for future episodes, send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection and breathing. Quick disclaimer reminder, the content shared in this podcast is for informational and entertainment purposes only.